Hi, Professor Cognard. It's nice to have you here in Paris, Link Paris 2025,
My
talking
pleasure.
about so important topic. It's a pleasure to be with the most fashion guy in INR. Yeah. But let's talk about the innovation topic, about protection and radiation reduction. Why we haven't been so dedicated to this so important topic. We'll just talk about progression in devices, but it's also important to have protection for the body, as we see so many doctors complaining about spine ache, and I'm one of these. And so it's really impressive how it may work, this kind of device.
So I don't know exactly why people were not focused on what they receive, the operator receive. We are always concerned about what the patient receives. And I remember cases where the patient lost completely their hair after a few weeks after a procedure. But then, for example, Laurent Spell, he told me that for decades he had no hair on the left leg, meaning that there is definitely an impact on the X-ray on the operator himself. We are used to wear the lead apron. It's like an armor, something that you take to go and work and do the difficult job we are doing. The problem as of today is that a lot of people had musculoskeletal pains and injuries, and they stop working because they have the neck pain, the back pain. Because we are wearing a lead apron of 0.5 millimeter or 0.35 millimeter thickness, and this is heavy. And with this cabin, we showed by the study that finally you can remove the lead apron. You don't need to wear it anymore. And this is really something very important in the daily practice, because we are all tired when we do cases at night or in the day to wear those lead aprons.
And besides that, the 90% reduction in the global radiation, does it concern to the other bodies that we can be protected by only by the lead apron and the other stuffs from prevention?
Exactly, and this is what, for me, it was a surprise of the study, because we always consider the dose which is received by the dosimeter, which is placed below the lead apron. But finally, when you look at, in our study, the dose that is received by this dosimeter under the lead apron, the dose you receive at the level of the head is 20 times higher than the dose that is measured here. So we are always focusing on this dose which is received here below the lead apron. But your eyes, your brain, your hand receive 20 times the dose. And when you use this cabin is like a wall between the machine and the operator. And finally, when you look at the result, you have 91% reduction in the dose that the body received, if you consider all the 7 measures by all the 7 dosimeters. So you reduce the dose at the level of the thorax and abdomen. You can remove the lead apron, but above all, the field of X-rays is much reduced. It's homogeneous. It's mainly coming from the patient, and the dose that you receive is a dose that comes from the patient. But and it's fun, because in the study we saw that the X-rays were going out of the patient by the introducer sheath.
Yeah,
this is incredible.
it's impressive.
Incredible. So, but finally, with the cabin, so the calculation that was made at the end is that if you do 300 procedures within a year, which is a lot for a neurointerventional neuroradiologist, then the dose you receive is 0.4 millisieverts in the year for 300 procedures, and which is much, much, much below than the minimal dose that should be received by the population.
Natural.
So finally, we all consider that we are working under the X-rays. in a quite hostile environment. But finally, with the cabin, you are more or less like anyone.
And in confirmation that this is the goal, will we have some legal issues with the place that can afford this cabin, or?
Yeah, but I think that the hospital directors will be pushed to purchase it, because you will reduce a lot the number of physician, technician, nurses obliged to stop working because they have back pain, which is enormous in a year. So I think it's really worth the investment. I don't know the price at all of this. What will be the price of the cabin when it will be available on the market? But definitely it's something which is, and it's really, you feel safe when you work under the machine. Huh? So when we did it for a month, we did 30 patients. And when we stopped and the cabin was removed, we missed it.
Yeah. It may be the price less than the doctors for back pain and other things. Okay.
Thank you.
Glad to have you here.
Thank you.
And thank you all.